Hey everybody, it's Dr. Lisa L. Campbell. I am back. Whoa. We are in week number 6 of our introduction to CPT HCPCS coding. And yes, we have 5 chapters again this week. So let's dig in and see what we have going on. So, we are starting off with chapter 15, which is maternity care and delivery. And one of the things that I like about this chapter is that we're literally at the end of the 50,000 series. So, let's dig in. So, as usual, we start off with some objectives. So, this is all about maternity care and delivery. So, we're going to be looking at key terms, abbreviations, common procedures and services guidelines. And then, of course, at the end of the day, you need to be able to code these services. So, from a definition perspective, obstetrics, because you hear obstetrics and gynecology together, right? So obstetrics is actually the specialty that treats women during pregnancy, childbirth, and the period immediately following childbirth, which is known as the puerperium, which is up to 28 days. Now, timing is everything when it comes to this specialty. And so there are a couple of terms you need to be familiar with. So, an embryo is the pregnancy from second week through the eighth week. This is where the embryo grows and develops into a fetus. A fetus is the ninth week until birth, usually 40 weeks. And then lastly, we have antepartum, and that's the care that is provided during the time prior to the day that the baby is born. So, when we talk about antepartum services, these are just things that a patient could have depending on their own history, status, and the care that has been arranged by their physician. So, an amniocentesis is where a needle is inserted into the amniotic fluid to withdraw fluid for examination. Now, you've heard of the word synthesis before. We've been talking about it all surgery, right? Then you have chordocentesis. This is where a needle is inserted into the umbilical cord, the umbilical vessel, to obtain blood from the fetus. Then we also have fetal stress testing and fetal scalp blood sampling. Abbreviations, as usual, those are in the very beginning of your textbook for this chapter. These are definitely abbreviations that you'll want to be familiar with. And having worked with an OB provider before, definitely I can tell you these are abbreviations that they use and probably some more. So, from a CPT coding perspective, as it relates to antepartum and fetal invasive services, you have codes for all of these different procedures that they do prior to childbirth. Antepartum care is usually reported with a no charge visit code because normal pregnancy visits are included as part of the book calls it the global period, but it's like the pregnancy package, right? So you have the antepartum visits, you have the delivery itself, and then you have the typical post-op care. Okay. All right. So some of the procedures that you'll see here, starting with 59100, you'll see Hydra. I can never say that word. Hydra something form mole, which is a grape like grouping of cysts that is really the ova cannot develop properly. Then you have codes for surgical treatment of atopic tubal or ovarian, requiring a salpingectomy or an oophorectomy. And this is because the pregnancy is occurring outside of the uterus. Then we have curettage. And one thing I will tell you is that there's a curettage in the female genital system. This one here is curettage postpartum. A curettage is surgical scraping. And in this particular chapter, we're talking about surgical scraping of the endometrial lining of the uterus being scraped after childbirth. All right. Introduction codes. We have a code for insertion of a cervical dilator. This is one of those CPT codes that is a separate procedure code. You want to review all of the instructional notes that appear before the code. Repairs. Repairs can be done during delivery, such as the episiotomy. And the episiotomy is an incision made at the vaginal opening to prevent tearing during the delivery. You also have a histography, which is a repair of a ruptured uterus, and also something that you have can have over there as well. You can have a cervical cerclage, and that is when the cervix is incompetent or unable to hold the pregnancy to term. So that area is reinforced until it's time to deliver the baby. All right. So speaking of delivering of the baby, and this is where I hate to say this again, but bubbling your CPT manual, I think is something that you really, 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 really want to do because these codes are tricky. So remember how I told you that there's this maternity package, right? Which includes the antepartum care, the delivery of the fetus, and then the postpartum care. And so, what you're going to see now are codes that present where one doctor does it all: antepartum care, delivery, and postpartum. But then you have codes where the doctor only does components of it, right? So maybe they do the delivery only. Maybe they do the postpartum delivery only. But then the other thing that really I want to call out, and hopefully you have your CPT manual in front of you, is that you first are presented with codes where the patient has a vaginal delivery, and those start with 59400. Then when you get to 59510, you have codes for still that package or separated, but in this case, the patient has a cesarean delivery. Okay. Then after that, you get into codes where there is a delivery after previous cesarean. And basically, what that is saying is today, the patient previously had a C section, but they are today going to deliver the regular way. But wait, there's more. But then we also have codes for um, vaginal birth after cesarean is unsuccessful. This is when they attempt to do the vaginal delivery, but they can't. Now, wait. That's so much stuff. Okay, so let's just I like to, group them into parts. So you have vaginal delivery only, you have cesarean delivery only. And for each of those, let's just call them buckets, you have codes that include the three areas, right? So the antepartum care, the delivery, and then postoperative care. So vaginal only, cesarean. Okay. Then the other two are vaginal birth after cesarean. They call it a VBAC. And so previously had a cesarean. Today they deliver vaginally. Then that fourth area is we expected to be able to do vaginal. Patient previously had cesarean, but today they failed to have a vaginal birth, and now we're C-section again. I think it's really important to spend some time looking at those options because you don't want to be trying to figure this stuff out on a day of your national exam. All right. So, other procedures that are available under here, abortion and other procedures. And I just want to be clear that in the world of medical coding, the term abortion is used to indicate that a pregnancy was ended prior to the time that a fetus reached a viable age, meaning being able to survive outside of the uterus, right? And there are different types of abortion. You have a missed abortion, you have an incomplete abortion, you have a legally induced abortion, you have a septic abortion, you have a spontaneous abortion, which is also known as a miscarriage. So it's very important for you to understand exactly what the patient had. All right, we are at the end of part 1 of 5 for week number, what did I say? Week number 7. And what did we do? We saw abbreviations, we saw the procedures, blah, 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 blah. I will see you back for part number 2, where we're going to be looking at the endocrine system.